This is an integrated therapy models and trauma treatment with a small focus on adolescents by Kimberly M. Jarrard, a doctoral student at Liberty University. Personal counseling theories. My personal counseling theory is a compilation of my experience in education, school counseling, my experiences through my doctoral program at Liberty University, online and in-person trainings on different therapy models. I have 18 years in education, mostly working with adolescents ages 12 through 18. I am a high school counselor, a mindfulness coach, the social emotional learning coordinator for our school on the district mental health team. I believe in positive psychology and experiential therapies. I also have attended ACT trainings in person and online mindfulness continued practice. So what is trauma? Trauma, the actual word means wound. Trauma is life-changing. Trauma is something that etches a thumbprint on the body, soul, and spirit. Trauma can affect a person's will to live, their perspective on life, their motivation, and it can affect a person's entire belief systems and their belief in God. Trauma is something that creates additional stress to everyday stressors. For example, you may be struggling financially. Now, in the community I live in, 18 months ago, we were affected by a devastating Category 5 hurricane. Although we are in the rebuilding phase and the resilience of our community has definitely shown through, we now are all facing a worldwide pandemic that is also exacerbating the already financial struggles that our community was having. Therefore, our trauma is now becoming complex trauma, creating additional stresses to everyday stressors. The clinical definition, according to the DSM-5 of trauma, is an exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. The exposure can be direct experience, where it's happening directly to you. You can witness it in person. You can learn of an event, of an actual or threatened death, of a loved one or a close friend. You can experience repeated or extreme exposure to adverse details of trauma, of actual death, serious injury, or sexual violence. And Linda Shoup defines trauma by saying, trauma by nature characterizes itself as an extreme psychological wounding that produces a sense of fear, horror, and helplessness. So what are our treatment goals for our treating trauma long term? Our outcome should be to increase feelings of control and safety in all areas of our client's life, to help them reduce behaviors aimed at avoiding situations reminiscent of trauma, to help them eliminate feelings of guilt associated with the trauma, also to help them to develop and maintain a sense of meaning in their own lives, as well as increase their ability to sustain meaningful relationships. The preferred theoretical modality for working with adolescents is cognitive behavioral therapy, otherwise known as CBT. This is preferred because it is short term. It can be treatments from as small as 6 to 20 sessions. It focuses on teaching the youth and their parents specific skills. It also focuses on how adolescents' thoughts, emotions, and behaviors are interconnected and all linked. And CBT approaches allow for a therapist to intervene at various points in the cycle. Under the umbrella of cognitive behavioral therapy, you can include things such as trauma focused cognitive behavior therapy, EMDR, eye movement desensitization and reprocessing, or ACT therapy, acceptance and commitment therapy. So, how do we get started? These can be applied to any therapy model. We need to first develop a healthy therapeutic relationship. We also need to make sure that the approach is client-based because no one-size-fits-all therapy works for anyone. We need to differentiate our therapy based on our intake, interview, and conversation because just like in education, no student learns the same, nor do they come to you with the same background information. Just like in therapy, no client comes to you with the same trauma experience. Lastly, we need to explain some safety features by teaching some basic self-regulation techniques so that the client feels that they have, in a sense, their seatbelt buckled. Therapy is a journey, and just like any journey, when we get in our car on a road trip, before even inputting the coordinates in your GPS, you always buckle your seatbelt and check your mirrors. In a sense, that's what you need to provide your client with in the self-regulation techniques. There are some basic ones that should be taught firsthand before beginning any therapy sessions to give your client tools and strategies if they're feeling overwhelmed. So, what are some of the relaxation techniques? Many of these can be found in mindfulness practices, focused breathing, progressive muscle relaxation, guided imagery, art, music, or sports. What is mindfulness? It's being present in the moment, being able to enjoy the moments of your life while you are in them without intrusive thoughts, worry, grief. Just like in this photo, you want to be like your dog when it's taking a walk with you. You're just enjoying your company, the sunshine, and the beautiful scenery. As in psychological first aid, mindfulness techniques can be implemented at any time and in any therapy model. The example here is grounding to help you ground yourself in your present moment when you're feeling disconnected. You do this by taking in a deep breath and then exhaling, and you identify 5 things in the room or in your environment that you can see. Then you take another breath and exhale and identify 5 things you can hear. I ask my students to identify sounds that are the furthest away from them that they can hear. Maybe it's a car or a siren in the distance. And then also to find things that are up close that they could hear. Maybe even can you hear your heart beating or your breath? Then taking another breath, identify 5 things you could smell or touch. And then you repeat this process until you are calm and present in the moment and able to clearly think and make decisions. Another self-regulation technique that is applicable to any therapy model or difficult life situations are your breathing techniques. Making sure you're breathing from your diaphragm. You can close your eyes and notice your breath, or you can implement what is called square breathing because a square has 4 sides. You breathe in through your nose, hold it for 4 seconds, breathe out through your mouth. Like I tell my students, it's like smelling the flowers and blowing out the birthday candles. This helps to relax the amygdala or the limbic system and allows to think more clearly. It helps you to take a break from the trauma and just in general, thinking more clearly and able to make decisions and determine that you are safe. As Cohen suggests, relaxation outcomes should be life skills applicable to anything. The goal is for children and adolescents to see that the skills they are learning can be generalized and applied to real-life situations, regardless of whether they are trauma-related. Mindfulness is the basis of acceptance and commitment therapy. ACT therapy is a psychological intervention that promotes psychological flexibility. Psychological flexibility means you're being open to all experiences with curiosity and acceptance. You're being fully in the present and living a fulfilled life. Acceptance commitment therapy is considered the third wave of behavioral therapy developed by Stephen Hayes. It is effective in treating anxiety, depression, chronic pain, phobias, OCD, panic, and PTSD. Acceptance commitment therapy can easily be incorporated with other therapy modalities. The goals associated with acceptance commitment therapy are that clients accept cognitions and emotions beyond their control. They encourage clients to make commitment to a life they value, and it takes steps towards an action. Acceptance commitment therapy uses metaphors, paradox, experiential exercises, breaking up fused thoughts, making healthy contact with cognition, feelings, memories, and physical sensations. It's more experiential than cognitive, providing empathetic support, encouragement, and reassurance, and has the motto of strong, open, accepting, responsible, and loving. After implementation of mindfulness and ACT therapy activities, you've a well-established safety system in place to move into internal family systems therapy. Internal family systems therapy was created by Dr. Richard Schwartz under the belief that all humans have the same parts or operating systems. However, some of us have parts that get stuck in the trauma. It's like having one part of you being stuck in the 8-year-old trauma that you experience while the rest of you matures and moves past the experience. The rest of the parts then feel the need to protect the part that is stuck in the trauma. The self is considered to be the center of internal family systems. It is the higher, best, truest version of ourselves. The self is the outside observer part that, when differentiated, will act as an active and compassionate leader with the qualities of calmness, curiosity, compassion, connectedness, confidence, creativity, courage, and clarity. The parts of IFS. There are four main parts in the IFS system. The self is at the center, and surrounding the self are the managers, the firefighters, and the exiles. As stated in the example, you may have an 8-year-old part of you stuck in the trauma that you experienced at the age of 8. And in the IFS system, you have protectors. You have your managers, whose role is designed to keep us from experiencing or triggering uncomfortable emotions. And these managers look like the perfectionist, the inner controller, the taskmaster, the underminer, the destroyer, the guilt tripper, and the conformist. And when that doesn't work, your firefighters go into place as a protector role by distracting the exiles, and they do not care how they, in a sense, put out the fire. And they can resort to drugs and alcohol, food, anger, cutting, self-harm activities, overworking, or sleeping too much. The firefighter and the manager are protecting your exiles. The exiles are the part that hold the pain and trauma, your big feelings. It's isolated from your conscious self for protection. It's the parts that get stuck. They're stuck in the hurt. They carry the burdens from being wounded. They carry feelings of rage, shame, fear, terror, dependency, grief, loss, and loneliness. How does IFS work? It starts by identifying what makes it hardest to think about what's going on. You could ask things such as, what brings you to therapy? Ask the clients to find the part that feels the worst. Give the client the control of the actions. Ask the other parts if it's okay to go there. And tell the other parts it's safe for them to take a step back while we talk to the part that's hurt. You can start anywhere in IFS. However, it is critical to look for parts such as self-harm, cutting, eating issues that could be an immediate physical danger to your client. The client is in control of the direction of the session and the parts that are addressed. The counselor is there as a facilitator and a safety gauge. IFS has great benefits. It can be a short process, but on average it can take 1 to 3 years, depending on the trauma. While it can take anywhere from 1 to 3 years, IFS has great benefits. It unburdens the exiles so they can be present. It allows all parts to relax. It allows all parts to be equally present. They're all seated at the table. It gives self more energy to lead. It allows for self-leadership. It provides the client with empowerment and control of the process. It also gives the client a positive mindset and changes self-talk to be more positive. There are some fantastic advantages of IFS. It's different from exposure therapy. It does not require a repetitive recounting of the trauma to re-traumatize the client. Resistance is now reframed to a positive mindset. It lets the client know that it was self-preservation that kept you stuck in that. It was your body's way of trying to protect yourself till you could get more help. The exiles then share the pain with all parts so that they are no longer burdened and hidden. The inner distance from the pain, because it allows the self or your spirit to witness the exile as they unburden from the pain. In a sense, the spirit connects to the parts that are experiencing the pain to comfort them through the process. The spirit guides and witnesses the process. It promotes self-leadership and compassion and helps them to view in a non-judgmental way the exile's feelings. Dr. J. Early creator and author of Self Therapy, states that IFS is a user-friendly, spiritually oriented, and very effective in working with trauma as well as a wide variety of other psychological issues. It's through self-leadership, where all parts trust you in self to make decisions and take action in your life. Christian worldview, spirituality, and therapy. Incorporating and leaving room for faith and spirituality using IFS therapy and mindfulness practices. The Christian integration of internal family systems therapy is evident in 1 Thessalonians 5:23. May the God who gives us peace make you holy in every way and keep your whole being, spirit, soul, and body free from every fault at the coming of our Lord Jesus Christ. This fits into the trichotomy of both Christianity and treating the whole person in therapy. Body treats the part, those are the aspects of the soul, and it treats the spirit, which in IFS theory is labeled the self. What is spirituality? The American Counseling Association defines it as a capacity and tendency that is innate and unique to persons. It tends to move the individual toward knowledge, love, meaning, peace, hope, transcendence, connectedness, compassion, wellness, and wholeness. Through research, Dr. Foy was able to find that most humans claim to be spiritual. And spirituality is a positive coping resource for trauma survivors. It provides them purpose and meaning. Therefore, IFS therapy, providing the opportunity and openness to include Christianity and spirituality, seems like the best option. Dr. Foy does also warn that there can be some negative effects after trauma in a spirituality sense. There can be some red flags where a trauma survivor has lost their faith, they feel guilty, they have a lack of forgiveness. There's also could possibly be theological conflicts, questioning themselves or God, asking, why do bad things happen to good people? And why did God let this happen to us or me? Conclusions on integrating therapy models. IFS, ACT, and mindfulness practices not only leave room for God and spirituality to be incorporated, they can become a major part of the healing process for your client. IFS, ACT, and mindfulness practices can be integrated and implemented together seamlessly. You can use mindfulness practices through any number of therapy models. IFS, ACT, and mindfulness therapy is client-centered and non-intrusive. It doesn't require your client to possibly re-traumatize themselves by revisiting the traumatic event. IFS, ACT, and mindfulness empower and make positive changes in the client from the initial sessions because you are providing them with tools of self-regulation. IFS, ACT, and mindfulness provide lifelong skills, strategies, and ways of thinking that can be applied to any life experience, not just trauma. IFS, ACT, and mindfulness theories are all based on reframing the way we look and think about trauma and trauma healing. It also presents your clients with normalized thoughts about their experiences. It changes them in a sense from the victim to the survivor. They are now in control. All of this is leading to a client that has increased their feelings of control and safety in all areas of their life. A client that has eliminated feelings of guilt associated with the trauma. They've increased their ability to sustain meaningful relationships, both with others and themselves. They've developed and maintained a sense of meaning in life. And ultimately, the client has gained an empowered mindset with self-leadership, and they approach themselves in a courageous, compassionate, and caring manner. This allows them to go out and be more present in their own life. Who better to leave you a quote with when concerning the need to incorporate body, mind, and soul than Viktor Frankl, the author of A Man's Search for Meaning and survivor of the Nazi concentration camp Auschwitz. Viktor states, "There is nothing in the world, I venture to say, that would so effectively help one to survive even the worst conditions as the knowledge that there is meaning in one's life." The next few slides are the resources that were used to create this PowerPoint.